Question 1. A client with heart failure is prescribed furosemide. Which assessment finding is most concerning? A. Potassium 3.1 MEq, LBBP 118/76, C. Urine output 45 ml per hour. D. Crackles at bases. Question 2. Which findings indicate worsening left-sided heart failure? SATA. A. Dyspnea on exertion. B. Peripheral edema. C. Crackles in lungs. D. Orthopnea e jugular vein distension. A patient with atrial fibrillation is at greatest risk for A. Bradycardia, B. Stroke, C. Heart block. D. Hypotension. Which medication requires monitoring of INR levels? A. Heparin, B. Enoxaparin, C. Warfarin, D. Aspirin. SATA. Which are signs of digoxin toxicity? A. Yellow vision. B. Bradycardia. C. Hyperkalemia, D. Nausea. E. Hypertension. Question 6. A client reports chest pain relieved by rest. This is most consistent with A. Unstable angina. B. Stable angina. C. Myocardial infarction. D. Pericarditis. Question 7. Which ECG change is expected with hyperkalemia? A. Street depression. B. Prolonged QTC peaked T waves. D. U waves. Question 8. Priority for a client with suspected MI? A. Administer morphine. B. Obtain 12-lead ECG. C. Start IV fluids. Question 9. A client with COPD should receive oxygen at A. 10 lNRBB, 6 L nasal cannula. C. 1 to 2 L nasal cannula. D. Room air only. Question 10. SATA. Which findings indicate respiratory distress? A. Nasal flaring. B. Use of accessory muscles. C. Oxygen saturation 96%. D. Tachypnea. E. Bradycardia. Question 11. Which position best improves ventilation? A. Supine. B. Trendelenburg. C. High Fowler's. D. Side lying. Question 12. A client with pneumonia has crackles and fever. Priority intervention? A. Encourage fluids. B. Administer antibiotics. C. Provide oxygen. D. Obtain sputum culture. Question 13. Which lab confirms respiratory acidosis? A. pH 7.48. B. PaCO 250 mm of mercury. C. Hydrogen carbonate 18 MEq, LD PaO 295 mm of mercury. Question 14. SATA. Teaching for incentive spirometer includes A. Inhale slowly. B. Hold breath 3 to 5 seconds. C. Exhale forcefully. D. Use hourly while awake. E. Cough after use. Question 15. Sudden dyspnea and chest pain post-surgery suggests A. Pneumonia. B. Pulmonary embolism. C. Atelectasis D pleural effusion. Question 16. Early sign of increased ICP? A. Bradycardia. B. Hypertension. C. Change in lock. D. Irregular respirations. Question 17. SATA. Which findings suggest stroke? A. Facial droop. B. Slurred speech. C. Chest pain. D. Arm weakness. E. Vision changes. Question 18. Best position for ICP? A. Supine. B. Hob flat. C. Hob 30 degrees. D. Trendelenburg. Question 19. Priority action for seizure? A. Insert tongue blade. B. Restrain patient. C. Protect airway. D. Give oral meds. Question 20. Which med treats Parkinson's disease? A. Haloperidol. B. Levodopa carbidopa. C. Phenytoin. D. Diazepam. Question 21. SATA. Multiple sclerosis symptoms include a muscle weakness. B. Vision changes. C. Tremors. D. Fatigue. E. Fever. Question 22. GCS score of 7 indicates a mild injury. B. Moderate injury. C. Severe injury. D. Normal. Question 23. Priority for DKA? A. Insulin. B. Potassium. C. IV fluids. D. Sodium bicarbonate. Question 24. SATA. Signs of hypoglycemia, a diaphoresis. B. Confusion. C. Polyuria. D. Tremors. E. Bradycardia. Question 25. Which hormone raises blood glucose? A. Insulin. B. Glucagon. C. Aldosterone. D. ADH. Question 26. Addison's disease causes A. Hypertension. B. Hypernatremia. C. Hypotension. D. Hyperglycemia. Question 27. SATA. Cushing's syndrome includes a moon face. B. Weight loss. C. Buffalo hump. D. Hyperglycemia. E. Hypotension. Question 28. Thyroid storm is treated with A. Levothyroxine. B. Propylthiouracil. C. Iodine contrast. D. Calcium gluconate. Question 29. Which lab confirms hypothyroidism? A. Low TSH. B. High TSH. C. High T3. D. High T4. Question 30. Best snack for diabetic bedtime? A. Candy. B. Protein plus carb. C. Juice. D. Soda. Question 31. Normal potassium range? A. 2.5 to 3.5. B. 3.5-5.0. C. 5.5-6. Question 32. SATA. Hyperkalemia causes muscle weakness, dysrhythmias, diarrhea, hypotension, tetany. Question 33. Best indicator of kidney function? A. Urine color. B. Bun. C. Creatinine. D. Sodium. Question 34. Client with ESRD needs A. High potassium diet. B. Fluid restriction. C. Increased sodium. D. NSAIDs. Question 35. Which drug treats hyperkalemia? A. Spironolactone. B. Calcium gluconate. C. Potassium chloride. D. Digoxin. Question 36. SATA. UTI symptoms include dysuria, frequency, fever, hematuria, hypotension. Question 37. Oliguria is urine output. A. Less than 10 milliliters per hour. B. Less than 20 milliliters per hour. C. Less than 30 milliliters per hour. D. Less than 50 milliliters per hour. Question 38. A dialysis patient with headache and confusion indicates A. Infection. B. Disequilibrium syndrome. C. Hypoglycemia. D. Stroke. Priority for depressed client who has a history of A. Therapy referral. B. One-to-one observation. C. Medication teaching. D. Family education. Question 40. SATA. Which tasks can UAP perform? A. Vital signs. B. Feeding stable client. C. IV meds. D. Blood glucose check. E. Initial assessment. Question 41. Client refuses meds. Nurse should A. Document refusal. B. Notify provider. C. Educate the client. D. All of the above. Question 42. Informed consent requires A. Nurse explanation. B. Provider explanation. C. Family approval. D. Witness signature ONL. Question 43. SATA. Signs of abuse, inconsistent stories, delay in care, multiple bruises, cooperative behavior, fearfulness. Question 44. Best response to anxious patient? A. Calm down. B. You'll be fine. C. Tell me what worries you. D. Ignore anxiety. Question 45. HIPAA allows sharing info. A. With anyone. B. With care team. C. With media. D. With employer. Question 46. SATA. Fall prevention includes a bed alarm, B. Non-skid socks, C. Call light nearby, D. Side rails X4, E. Adequate lighting. Question 47. Medication error occurs. Nurse first. A. Complete incident report. B. Notify provider. C. Assess patient. D. Inform manager. Question 48. Which client is priority? A. Pain 6/10. B. Nausea C. Sob D. Anxiety. Question 49. Cultural competence means A. Treat everyone the same. B. Ignoring beliefs. C. Respecting individual values. D. Using stereotypes. Question 50. Best indicator of teaching effectiveness? A. Client nods. B. Client restates info. C. Family agrees. D. Handout given.